Have you been told that there's no point to measuring your hormones because you're in perimenopause? Perhaps someone told you that there's no accurate or helpful way to assess them, and you just have to find a way to cope with the disrupted sleep, weight gain, heavy or irregular periods, fatigue, or other frustrating hormone symptoms. Well, keep watching, because in this video, I'm going to share 2 different techniques for accurately and actionably measuring your perimenopausal and menopausal hormones, both of which you can do from the comfort of your own home. A client emailed me the other day asking about possible root causes for some sleep issues that had popped up. She's in her mid-40s, so I mentioned perimenopause as a potential trigger. She wrote me back immediately saying, "Whoa, you just blew my mind. I didn't even know what perimenopause was until I Googled it." Now, this lady doesn't live under a rock, and she is invested in her health, so I was a bit alarmed that she'd never even heard of the term. It turns out that a recent survey conducted by the North American Menopause Society found a significant lack of awareness of perimenopause and menopause, despite the fact that thousands of women enter this transitional stage every single day. And most medical doctors are unprepared to advise these women. One survey reported that only 20% of OB/GYN residency programs provide any kind of menopause training, and most of those doctors get just 1 to 2 hours of menopause and perimenopause education in total. That's more than a little bit alarming, if you ask me. So before we dive into your options for accurate and actionable lab testing for hormones during perimenopause, let's get clear on what it is and what it involves. By definition, perimenopause is a time of transition when reproductive hormones like estrogens and progesterone gradually decline leading up to menopause. But let's be clear, I use the term gradual loosely because it's very common for women to experience sharp, sometimes extreme fluctuations of estrogen during the perimenopausal transition. And progesterone may be normal 1 month and nearly absent the next, depending on irregular ovulation. Both of these hormones have a significant impact on how women feel during this transitional phase. But more importantly, perimenopausal changes may set women up for increased risk of serious and preventable health problems in the future. Problems like osteoporosis, cardiovascular disease, metabolic syndrome, and even cognitive problems like memory loss. Perimenopause is not a quick transition. It can last up to 10 years, with the average being around 4 years, and it tends to start in a woman's late 30s or early 40s, depending on factors like overall hormone health and genetics. Some common symptoms of perimenopause include brain fog, anxiety, irregular cycles, hot flashes, night sweats, mood swings, and changes in libido. And some less recognized symptoms include heavy periods, sleep problems, dry eyes, skin, hair, and vaginal tissue, irritability and short-temperedness, being more easily overwhelmed, weight gain, especially in the abdomen area, hair loss or thinning, and even less tolerance for alcohol. So what's happening to your hormones during perimenopause, and why? One of the reasons perimenopause begins is the declining sensitivity and function of your ovaries. The brain can't communicate with them as well as it used to, and the follicles that turn into eggs aren't as young and plentiful as they used to be. That's why one of the first hormones to decline in perimenopause is typically progesterone, because ovulation, or the release of an egg from the ovary, doesn't always happen each month. While that might not seem like a big deal for folks who aren't trying to get pregnant anyway, progesterone is a really important calming hormone for women. It helps support stable moods and healthy sleep, and it balances the more fiery estrogen hormones. That's why some women experience sudden insomnia, where they can't fall asleep or stay asleep, heavier periods, less resilience to stress, or more anxiety and irritability during perimenopause. When it comes to estrogen, things get really weird. Some women experience a decline in estradiol once they start skipping periods, But sometimes estrogens will spike and crash erratically during perimenopause, resulting in intermittent symptoms like mood swings, hot flashes or night sweats, anxiety, joint inflammation, brain fog, and out-of-the-blue weight gain. Many women find that absolutely nothing has changed in their life, their diet, their exercise, and even stress levels, and yet they suddenly find themselves 15 pounds heavier, bloated, cranky, and unable to sleep at night. It's extremely frustrating, to say the least. That frustration only grows when a woman visits her doctor, only to be told there's no way to test these hormones, and that treatment is limited to antidepressants or weight loss drugs. That's why I'm talking to you about this, because you do have options to assess and address the root cause of your perimenopausal symptoms. And it's important that you know about these options, because you should not have to just put up with or suffer through perimenopause. Yes, this hormonal transition is part of life for the majority of women, but that does not mean that you have to resign yourself to feeling groggy, dull-witted, in pain, or not like yourself. And you certainly don't have to resign yourself to the increased risk factors associated with hormones that drop too low, things like dementia, osteoporotic fractures, or heart attacks. If you don't test, how can you take confident and informed action? The first functional lab test for perimenopausal hormones is one that I utilize almost every day with my clients. It's called the Dutch test, and it's an at-home dried urine test that measures over a dozen hormones and hormone metabolites and gives deep insight into hormones during any phase of a woman's life, including perimenopause. This comprehensive test will help you assess the balance between estrogen and progesterone, help you catch progesterone decline early, and most importantly, it will tell you if you're detoxifying your estrogens in a safe and efficient way. It also measures adrenal hormones like cortisol and DHEA, both of which play a crucial role in hormone balance during perimenopause. If you're worried about declining libido or losing muscle mass, the Dutch also measures androgenic hormones and their metabolites, which can make or break your vitality in perimenopause and beyond. Even if you've had an ablation, a hysterectomy, or you've had irregular cycles, you can still use the Dutch. I've reviewed and explained hundreds of Dutch results to my clients over the years, and nearly every one of them expressed regret that they weren't told about this game-changing lab testing sooner. The great news is that you might be able to order this test yourself, and I'll even help you interpret the results. Check out the link in the video description for more info about getting a hold of your own Dutch test kit. The second lab testing option that helps you sort out your hormones during perimenopause utilizes some really sophisticated technology to get you real-time hormone readings at home. The Mea Hormone Monitor and corresponding tracking app allows you to measure up to 4 key hormones or hormone metabolites to detect estrogen levels, progesterone levels, and ovulation indicators like LH and FSH. The testing process is simple. First, you collect a urine sample using the collapsible washable cup included in your kit. Then you dip the test wand into the urine sample for a few seconds and insert it into the discrete hormone monitor device. It's basically a miniature lab that you can hold in your hand. 21 minutes later, you'll be able to see your hormone levels on the app. Did your estrogen levels spike way up since yesterday? Might be a good idea to take some DIM or indole-3 carbinol to make sure you're detoxing it properly. Did your progesterone levels drop? Could be why you didn't sleep well last night, or perhaps you skipped ovulation this cycle. These are just examples of why real-time data can be super helpful during perimenopause, not to mention the long-term trends that you can track with the app and share with your provider if needed. I've found that many women have been told that hormone tracking is only helpful if you're trying to get pregnant, but that's simply not true. Being able to correlate symptoms to hormone fluctuations, for example, why do I get hot flashes some nights but not others? This helps you and your healthcare provider choose the best treatment strategy. And keeping track of broader trends, for example, has my progesterone dropped slowly but steadily over the past 3 months? This helps you initiate those treatments at the right time. I'll be sure to include some more information about Mira at that link in the video description as well. And if you do decide to try Mira, be sure to use the coupon code KMLD15 for 15% off your first kit. During perimenopause, when your mental, emotional, and physical health seems to be changing in unpredictable and frustrating ways, having accurate and actionable data about your hormones can give you back a sense of agency in the process. Not only does it help you wrap your head around what's happening to you, but it also helps you take action to address it at the root. And I'm all about root cause strategies. Thanks so much for tuning in to this extra important video. My mission here on YouTube is to help connect folks like you to science-based functional medicine resources so that you can make the best, most informed decision for your health. And that all starts with accurate data, which is why I get so excited about functional lab testing like the Dutch and Mira. Be sure to check out the links in the video description for more info about ordering both of these hormone test kits, and don't forget to use that discount code. Thanks again, and we'll see you in the next video.